I think what's most rewarding about being a shoulder and elbow surgeon is seeing our patients come back after treating them either with non-operative, non-surgical ways or with surgery, and to see them come back and say how much better they feel, how much more they're able to do with their arm and their hand. They're able to raise their arms above their head, and even something as simple as reaching for a cup out of a cabinet, or being able to reach their hand up to do their hair, or to even dress themselves. By having helped them through their problem with their shoulder and elbow, to help them get to the point where they can get back to those normal daily functions and see the happiness that brings them, I think that brings me a lot of joy. Early on in my childhood, I knew I wanted to be a doctor, and I was interested in medicine when I was very young, and I had a big interest in the human body and how it worked, and that interest carried on throughout my schooling years, where I became more interested in anatomy and then how anatomy would falter, and how people were affected in their daily lives by breaking down of anatomy and wear and tear, and that evolved into how we could fix it, and so it led into medicine and the interest in medicine and how I could help people through trying to restore their bodies and their anatomy to what it was. But I had a close relative, my grandfather, who underwent a joint replacement. He was very affected by arthritis and had a joint replacement, and I remember seeing the difference in his life and how much his quality of life improved after undergoing that surgery, that I was amazed that somebody with an understanding of anatomy could understand how to reconstruct it in a way that could make such a difference in someone's life. And so my interest really focused in on orthopedics at that point. The shoulder and elbow is a challenging part of the body, I think, and it's has a lot of diverse function that a lot of other joints and parts of the body don't have, and the utility of the shoulder and elbow, I think, goes a long ways in everyday life. And so I think it was interesting to me from both a challenging perspective, wanting to learn more about it, as well as trying to make a difference in patients' lives just every day in the use of their arms, and so it all came together at the shoulder and elbow. The reason I chose Washington University Orthopedics was because of the great environment that it is to work, the excitement that people and the partners here in the group have for what they're doing and for patient care, for advancing their respective fields, and for the real the resources that exist here to be able to execute those ideas and really take things to the next level. Our primary focus is to treat patients, and at a place like Washington University, at a big academic center like this, I found it refreshing that matched up with my personal priority, which was just to take great care of patients first, and that is a philosophy echoed here at Washington University.